Director of Ambulatory Nursing for a large academic medical center in Colorado. I have been a nurse for 30 years and I have been in nursing leadership for 20 years.
Awesome. This is going to be good. You have a lot of experience. So Terrie, talk to me about your team and what makes it great.
I believe what makes my team great is their cohesiveness. They have a high level of respect for one another. They are able to bond together. They consult each other and lean on each other for expertise. So it's interesting that I don't have several nurse staff members that have the same skill set. They have a lot of diversity, and I think that we've done a good job of hiring for fit, and so people get along really well together, and we have a common denominator, and that is we're very passionate about taking care of our patients, and we're very passionate about taking care of our staff.
So Terrie, you bring up a really good point. When I'm interviewing for a new nurse, I always tell them I'm first hiring for the team, second for the organization if they should ever outgrow the team, and then third I'm hiring for the position. Because as a nurse, I feel like I can teach you nursing things.
Exactly.
So talk to me about how this fits into the way that you hire.
I think when we see a skills gap, we can write a teaching plan, a competency assessment plan for a team member. But when you hire and you can see that personalities aren't going to fit, that's going to cause disruption on the team. And frankly, it takes time away from our patients. And so I try to hire nurses who have great attitudes, are adaptable, flexible, and when I can find nurses who have the same love and passion for nursing, especially when they have experience and they've never lost that passion and love for our patients, it's easier to bring people back. So if they start to stray from the team vision or the organizational vision, it's a lot easier to bring people back to here's our common mission. We're here to take care of our patients, and we're here to be healers and comforters. So as long as we have the same core values, it's a great relationship. But when people have different values, and then it can be difficult to have that collegiality and that common goal.
Awesome. So you also talked about diversity. How did you strengthen your team's different strengths and what they're good at, and that you make sure that their uniqueness is shown?
Right. Part of it is highlighting someone's skill set. So everybody on the team knows that this particular nurse educator is really great at telephone triage, or this nurse educator is really good at doing procedural-based educational curriculum builds. But we also don't want to be in a position where one educator goes on vacation and then there's a need, and then the whole department's reputation suffers because we can't meet that need immediately. So what we try to do is partner people up and give people new opportunities. And I've had educators come to me and say, I know nothing about telephone triage, and so I'm coming in this as a novice. 2 years later, they're being published for their telephone triage work.
Awesome.
And so I like to remind them of that growth and how proud I am that they were flexible and had a great attitude about learning a new skill set. And it's made them stronger, and it's been inspiring for other team members to take that risk. They may not know a lot about care coordination. That might not have been their background when we hired them, but they see that another educator was able to do it and have the resources they need. I think that's the other thing as a leader. It's up to me to provide them with the resources. With my nurse educator, I told her, I'm going to send you on some field trips to some call centers, and you're going to see what telephone triage is really like. So I think it's about supporting your team and being an encouragement. And I also believe that as a leader, I have to make sure that my team knows it's okay to fail fast. It's okay to skin your knees, but not cut your wrist, but skin your knees.
Yes. So for all the new leaders, or even maybe some of the more seasoned leaders that may watch this video, what would be your one piece of advice that you would give them?
When I mentor new leaders, I tell them to start working on their legacy now. Start building your legacy. And, you know, how do you want to be remembered as a nurse later? And keep that in the forefront because, you know, building our reputation is a lifelong journey. And for me, I want to be the best boss my team ever had. And I don't make any assumptions that they've had bad bosses. It just means that I want them to look back on my time of nursing leadership with them, that I was fair, that I was transparent with them, that I supported them, that I gave them the resources they need. And because I know what legacy I want to build, it frames how I show up at work. And it frames, on a bad day, what brings me back to work the next day.
Awesome. Terrie, I thank you so much.